Language is a complex process, and there are actually different parts of the brain involved with different aspects of language. For example, Broca's area, located in the frontal lobe, is the part of the brain responsible for expressing language, whether vocalizing it as oral language or expressing it in terms of written language. That's the domain of Broca's area. In contrast, with regards to understanding language, comprehending it, a different part, Wernicke's area, it's spelled with a W, but the pronunciation is Wernicke's area, is the area of the brain responsible for comprehending both oral and written language. Which is why, if this part of the frontal lobe is damaged, is diseased, this can lead to a disease called Broca's aphasia, wherein the patient can understand language but is unable to correctly express it, vocalize it, and write what he or she wants to say. In contrast, if this part of the temporal lobe, which is Wernicke's area, is damaged, this can lead to Wernicke's aphasia, wherein the patient can express, can vocalize, can write language, but he or she is unable to understand or comprehend it. That different parts of the brain are involved in different aspects of language is supported by PET scans. PET scans reveal that blood flow increases in different parts of the brain depending on what aspect of language is most prominent. For example, when we hear words, there is increased blood flow in this area, which is, you guessed it, Wernicke's area in the temporal lobe. When we see words, for example, when we're looking at the pages of a book, hopefully we're also reading the book. But when we see words, increased blood flow is noted in the occipital lobe because it is the occipital lobe which is responsible for vision, for processing vision. When we speak words, this part of the brain has increased blood flow and is most prominent in the PET scan because this corresponds to Broca's area in the frontal lobe. And finally, when we are conceptualizing, when we are generating words, for example, we're thinking of writing a poem, when we are thinking of writing an essay, there is increased blood flow in this part of the frontal lobe. This is the prefrontal cortex. And the prefrontal cortex is the part of the brain that is responsible for conceptualizing, for planning.